Good morning, good afternoon, good evening from wherever you might, excuse me, wherever you might be viewing this from. 2 days ago, I reported that Israel was coordinating the delivery of 25,100 vials of polio vaccine to Gaza amid fears of a polio outbreak. I reminded you that CV-19 has reemerged. Mpox cases are popping up in different parts of the world, and now the threat of polio. Then I asked, what's next? Well, we didn't have to wait long for an answer. In an article from the Jerusalem Post dated August 29th, 2024, the article reads, Sudan's cholera crisis compounded by conflict, crowded camps. A renewed outbreak of cholera in Sudan is now endangering displaced populations across the nation. The United Nations Refugee Agency, or UNHCR, has warned. The spread of the disease is particularly alarming in Kassala, Gadaref, and Jazeera states, regions that are sheltering not only refugees from neighboring countries, but also thousands of internally displaced Sudanese seeking safety from the continuing violence. Asadullah Nasrullah, communications officer for UNHCR Sudan, noted that this cholera outbreak is the second to occur since the onset of the ongoing conflict, which began in April 2023. He told the media line, the cholera outbreak in Sudan is deeply concerning, especially for vulnerable communities displaced by the conflict. Currently, there are 143 cases that have been confirmed among refugees in Kassala state, and tragically, 5 lives have been lost. Over 10 million people have been displaced internally, with an additional 2.1 million fleeing to neighboring countries such as Chad, South Sudan, Egypt, Ethiopia, and others. This conflict has intensified humanitarian needs, particularly in regions heavily affected by violence where access to healthcare and basic necessities is severely limited. I think the most important part of this report is the very last paragraph. Over 10 million people have been displaced internally, and this is the part, with an additional 2.1 million fleeing to neighboring countries such as Chad, South Sudan, Egypt, Ethiopia, and others. So, if you have the reemergence of CV-19, Mpox, polio, and now cholera, and these 2.1 million people are fleeing throughout various countries within Africa, how long is it going to be until the World Health Organization declares that cholera now is a global threat? Is this just the next shoe to drop? To me, that's four in the last, week and a half? I would pay close attention to what's going on. You know what's coming, and so do I. Till the next time, have a great day.